Hi. So right now I'm 2 weeks post-op. I didn't record a 1 week video because there wasn't really that much changes. I had the same range of motion and soreness. Everything was still numb from the medication that they gave me during surgery. But then after I had the drains out, there was some issues. So the problems with the drains was I healed way faster than expected. So I don't know if it was my skin, my muscle, whatever it was, it started to adhere to the drains, so they were just, the drains healed into my body. So I should have gotten them taken out sooner. But my drains, they came from these holes right here. So it came from here, and it went all the way down here, and then up to the middle of my chest here. I see other people, the drains just go here, and that's it. And then they just go and take the drains, pull it out, done. But mine was all the way up here. It just became part of me. It was not fun. They look real close. The nipple is looking fine. This little scab right here is just dangling on for dear life. And the drain holes, it's looking alright. It's healing. But scabs falling off here. I have a bit of bruising right here, which that's okay. I just massage it out. That's where they had the liposuction. And then the nipple, scabbing over, and the scabs are falling off, and there's just a lot of different colors going on there. It's really pink. I'm getting some sensation back here. I can feel this. This is still kind of numb. I can feel the pressure when I'm pressing on it. There's a bit of scar tissue building up right here where the drain was. And you can see there's still some fluid buildup right here. Same on this side too. Don't want to squeeze it too hard because it does leak a little bit. Range of motion, it's still the same. I've had a lot when I came out of surgery, so I can lift it all the way up here, and apparently I can't move my arms at the same speed. Just not coordinated. I haven't really tried to lift up anything heavy yet. I don't want to try that. I'm only 2 weeks. I want to wait till 6 weeks. I want to try to heal as smoothly as possible. Oh, yeah, sideways. So, this is what it looks like from this side. This side too, so it's actually looking really good right now. I haven't really looked at it like this yet. Wow. Now, I'm gonna talk about post-op depression. So if you don't want to hear about that, click away. I just thought I should point this out. So I don't really have bottom dysphoria. I have a little bit, but it's not too bad. And I've heard a lot of people talk about after they get top surgery, then they then it emphasizes their bottom dysphoria. But I thought, well, I don't have bottom dysphoria. It's fine. But actually, it did affect me as well. So the thing is, because I've been so focused on my chest, so everything, whenever I look at myself, I'm like, oh, my chest, I can't wait to get rid of it. But then after, when it's gone, it really focused the emphasis to the curve of my waist and my hips. It's not much because I'm pretty small, but I can see it where it comes in like that, and then it tapers back down, kind of like an hourglass, but not really that much. So that made me feel pretty bad for a bit. But then after, I realized, well, if I just exercise, because I am trying to gain some muscle, because I don't know if you can see, I don't have much. My ribs are a little bit prominent here, and just, I don't know, I guess this is the muscle fibers, whatever little bit I have. So yeah, if I work on my muscles here, and it's not really much I can do. I just gotta live with it. So I'm cool with it now. First time I saw it before I got my drains out, it was kinda, I didn't like it. It made me feel bad. Showering with the drains on sucked. I had them on the lanyard. Just hang it here. I had it there, but the problem was my drains were just sticking out like that. So it was a lot of tugging. It was such a hassle. I had to just like hold it up like this and wash myself. What I ended up doing was just I had the shower head facing like as low as possible, and I just sat on. I washed everything that I could, like my leg, like everything from the waist down. I washed that and my head, neck, face, arms, and all that. And then when I went to do this, I just sat on the ground, and then I just sat there. I took off the lanyard, put it on the ground, and I just sat there and just washed myself like this, rinsed myself all off, put it back on. So if anyone's having any problems like that, I would suggest just sitting on the ground and put it there. It relieves a lot of the pressure on here and less tugging when it's actually sitting on something sturdy instead of just your neck. Alright, so as a bonus, I'll show you how to put the dressing back on. I just washed my hands, everything's all clean. I have this big gauze right here, that's what I put like that. But I also got these little gauze pads right here. It comes a little bit bigger. It'd probably cover my whole chest if I use the full thing, but I cut them up because I don't need that much gauze. It's okay. So I just place it there. Got a little tape. I like to lean back a bit because or else it will just slide right off. Okay, and I'm gonna put a little bit of ointment on. I forgot to put. This is the worst tutorial ever. I'm sorry. All right, go for it. Okay, so put a little bit of ointment just all over on these little spots. Oh, that needs a little bit more. Okay. You have a little scab that's barely hanging on right there. And this one, make sure to put a lot of ointment because it's really dry. So this isn't necessary. I just did this so that because it's bleeding a little bit, I don't want that all over the place. So then you just kind of stick this on here. This is just for padding, really. And then I have this, which is just like a thick ace bandage with Velcro on the end of it. Make sure the straps are on the outside of the binder because it's just easier that way. They don't actually do that much. It just holds it up, I guess, but it's tight. It's not going to fall off. You don't have to really put it that too tight. You need to still be able to breathe. It's just more to reduce swelling. Obviously, this would be easier with someone's help, but it's doable without. Yeah. So there's a little line right here. I put that kind of right where my nipples are, so it gets a lot of compression because that's where I have a lot of the swelling is right here. But they advised me to wear it pretty high. Most of the stuff that was done, like although the incisions are here, a lot of the stuff was here. That's where they did the liposuction. They did it all up to here, to my armpit. So yeah, I put it up there, and then, while I'm just hanging out, I just massage it like that, just to get some swelling out, especially where I have the bruises here. Bruise on this side and this side. It's a little tender, so I just massage it through. I just use these knuckles here. And even here too, I like to just squeeze it to the side. It feels good, not having the fluid here, so just do that. And then, once or twice a day, just take it off and do a little massage. You can do it before you shower. Yeah, just make sure that you're still getting, all that spread out. and massaging it through so you don't get any scar tissue. And here too, make sure you're still stretching so you don't lose your mobility. Alright, so I think that's it. Thank you. Bye.